as an inflammation review, we look at a reaction to injury, a release of chemicals, a vascular response, and then the things, because of those two things, fluids, white cells, clotting factors can migrate to the site. Inflammation can cause some severe pain, especially because of the chemicals released. So we have some anti-inflammatory drugs, including NSAIDs, steroids, some anti-rheumatic and anti-gout drugs. NSAIDs are non-steroidal anti-inflammatory drugs. They have analgesic, anti-inflammatory, and antipyretic properties. Please note, only ibuprofen and aspirin are recommended for fever or headaches. They inhibit the COX enzyme. They include ibuprofen, naproxen, and ketorolac or Toradol. NSAIDs have a couple of generations. The first generations include salicylates, Para-Chlorobenzoic acids, Phenylacetic acids, Propionic acid derivatives, Phenamates, and Oxicams. Second generation NSAIDs include COX-2 inhibitors. Aspirin is actually considered an NSAID. It's the oldest non-opioid. There's an inhibition of COX-2, decreasing inflammation and pain, and an inhibition of COX-1, breaking down stomach lining and protection. So there can be high risk for gastric irritation, ulcers, bleeding, that kind of thing. Aspirin is associated with Reye syndrome, especially in children, so it should not be given to children. Side effects. Drug interferences include gastric irritation. That's a big one because it's so common. It's increased with steroids. Sometimes people will get an enteric-coated aspirin. Vertigo, bronchospasm, urticaria, tinnitus, increased bleeding, hypoglycemia, and the hypoglycemia can happen with oral anti-diabetics. Tinnitus is also a very common one because it happens so often, and increased bleeding happens quite a bit too. So you've got to remember those two also. The therapeutic range of aspirin is 15 to 30 milligrams per deciliter. Do not take aspirin in the third trimester of pregnancy. Don't take it with other NSAIDs. Note that for children with viral illnesses especially, we do not give aspirin to them. There's an increased risk of Reye syndrome side effects and adverse reactions. Again, I'll talk you through them. For aspirin are tinnitus and hearing loss from overuse or overdose, dizziness, confusion, drowsiness, peptic ulcers, stomach issues, blood dyscrasias, thrombocytopenia, leukopenia, agranulocytosis, hepatotoxicity, and severe poisoning can actually result in convulsions and cardiovascular collapse and coma. Para-Chlorobenzoic acids. An example of this would be indomethacin. Indomethacin is kind of famous for sodium and water retention and increased blood pressure. So that's one of its specifics you need to watch for. Phenylacetic acid derivatives. A good example of that would be Voltaren or diclofenac sodium. So for rheumatoid arthritis and other arthritises, and for ankylosing spondylitis, which is a spine problem, a degenerative spine disorder. No antipyretic effect in this one. Toradol is another phenylacetic acid derivative. It inhibits prostaglandin synthesis. It's often used in IV form. Make sure to dilute it, otherwise it'll hurt. Inform the patient about pain during administration. Propionic acid derivatives are the ones that you are most familiar with. And these include ibuprofen, naproxen, and ketoprofen. Big issues with these are bleeding, so increased tendencies for bleeding because it makes the platelets slippery. Kidney problems, and stomach irritation. Phenamates are another type of NSAID. They're often utilized for arthritis. They're long-term. So melophenamate and mefenamic acid. These tend to have the word phenamate right in the name. Oxicam. So if you have a dog that has had any type of arthritis or anything, they may have been given Para-Chlorobenzoic Acid. So I often call this one doggy-profen, but they use it for humans now too. So it's short-term rheumatoid arthritic problems that they use it for. Can cause peptic ulcers and gastric distress. Takes 1 to 2 weeks to work fully, and don't take it with other NSAIDs. Selective COX-2 inhibitors include Celecoxib. You remember Celebrex? And now they don't prescribe it very often because of the increased risk of MI, of a heart attack. So the trade-off to not have gastric distress from this is not a good one, to have a higher risk of having an MI. So they just really don't prescribe this very often anymore. Corticosteroids include some examples like prednisone, prednisolone, dexamethasone. These suppress inflammation. Not first line for chronic arthritis, but it's used for flares of arthritis. So same thing with asthma. It's not typically used systemically for chronic issues, maybe locally for asthma, but for flares, systemic corticosteroids can be used. These need to be tapered off. It's not good for the kidneys to be on it for a while and then just abruptly stop. So the examples, prednisone, prednisolone, dexamethasone, these should all be taken in the morning because otherwise the person's not going to get any sleep most of the time. And they need to be taken with food because it's going to upset the stomach. And that prednisolone in the middle, that's the kiddie version. The prelone is the type that kids will take. And when they take it, it needs to be followed by something yummy because the taste is horrible. And adherence to this medication regimen is not going to be there if we don't do something about it. So oftentimes you can give an Oreo cookie right after giving prednisolone. Gout. Gout involves an inflammation of the joint, tendons, etc. It's often in the great toe. Contributing to the frequency of gout, the risk of gout, are purine-containing foods in certain genetic, in people with certain genetics, they're more prone to getting it. So when people get it, you should advise them not to have purine-containing foods, especially beer. So it's caused by this error in purine metabolism. Treatment includes colchicine, allopurinol, and uricosurics. Tylenol is another one we need to talk about. And Tylenol doesn't really fit into the anti-inflammatory portion, but we do need to talk about the new recommendations of only 3,000 milligrams per day. In your ATI, it actually, the voiceover will say 3,000 milligrams and the sheet will say 4,000. Used to be that we had Tylenol in the 4,000 range per day, but now it's 3,000. It's very liver toxic if you take too much. It's not an NSAID. It does work by inhibiting the synthesis of the prostaglandins. So it does do that, but we don't know the full extent of how Tylenol works. There are a lot of things about it that we don't know. And it is over the counter and it's been around for years, right? Okay, so opioids are for moderate to severe pain. They act on the CNS by binding to opioid receptors. They suppress respiration, pain, cough, diarrhea. So, in other words, opioids make people constipated, lowers their respiration, decreases their gag reflex, and gets rid of pain. Side effects to watch for with opioids are confusion, constipation, and not being able to breathe. Examples of opioids include morphine, Dilaudid, and fentanyl. Norco and Vicodin are another example. Percocet's another example. Oxycontin, oxycodone, MS-Contin, Vicoprofen, and Tylenol number 3. Norco, Vicodin, and Percocet have Tylenol in them, so be careful so that it isn't being given at the same time as other Tylenols, and or that you don't go over that 3,000 milligram per day limit. Oxycontin and MS-Contin are continuous, so they are extended release. Oxycodone is immediate release. Patient-controlled analgesia, we'll skip over. We did that in class, though. Transdermal opioids like fentanyl are used, and they give a certain amount of the drug per hour. Don't write on them once they're on the patient. Don't heat them up once they're on the patient. These things can cause an excess release of the fentanyl. And be careful how you dispose of those so that kids aren't eating them. Adjuvant therapy is something we need to talk about, because adjuvants are treatment that's given in addition to the primary treatment. So like the Tylenol that's given as an adjuvant to the oxycodone in the Percocet is a prime example of this. Opioid antagonists include Narcan, naloxone. You should know that word. That's the reversal agent for the opioids. Now, Imitrex is a completely different drug. It's not an opioid. It is used on pain. It causes vasoconstriction of the cranial arteries. So this is good for people who get migraine headaches, cluster headaches, and have had vasospasms. So this stops the vasospasms that are causing the migraine headaches. So, all right. Well, good luck with studying, and have a great day.